Hey folks, welcome back to Transplant Oprah again today. My name is Jim Merle, and it's a beautiful, gorgeous day here in Alabama, but here I am. I'm inside filming this. I probably should have went outside to do this, but I had a person reach out to me just a few moments ago, basically saying that they're brand new to transplant. They're having quite a bit of difficulty with some of the new medications, particularly immunosuppressant drugs they've been placed on. The doctor keeps switching things up left and right, kind of getting confusing, and they're wondering if that is normal. Okay, so with that being said, in general, yes, it is normal. It is absolutely normal to be having issue with your medications, particularly in the beginning. I would probably say for most of us, between the first month to 3 months post-transplant, your body is going through so many different changes, whether it be healing itself or dealing with the brand new medications, you're going to have quite a few of difficulties. For example, medications such as Prograf, aka tacrolimus, or mycophenolic acid, aka Myfortic, can be rather difficult on the system, particularly when it comes to the digestive system and that sort of thing, can give you some real issues in the beginning. Now, as far as your doctors continue to swap things up, there may be a good reason for that. For example, with those immunosuppressant drugs, they're trying to kind of hit a very fine line, a very razor sharp line that exists there between getting the right levels in your bloodstream, keeping you protected, keeping you from injecting your organ, and at the same time keeping you from having too many side effects. However, oftentimes there's just kind of a balance there. There's a to an extent, you're just going to have to deal with some of those side effects, at least in the beginning, in order to stay safe. Now, the good news is once those dosages begin to come down, hopefully you'll get some relief from the side effects. Hopefully things will get a lot easier. They typically do, and you'll do a lot better. Now, as far as them swapping them up constantly again, if they're doing that because they're not finding the right levels in your bloodstream, fine. But if they're doing that because maybe you're giving them feedback, or I wouldn't say complaining, but you're giving them feedback that says, hey, this medication here is tearing my stomach up, or I can't sleep on this one. If they're making those swaps in the beginning because of something you're feeding back or reporting to them, you might want to back off just a little bit, because again, as you get farther into this, maybe a month to 3 months out, many of those symptoms will subside even on their own, even if the dosages and the medications themselves stay the same. It just takes a while for your body to adapt. So I would say in that case, maybe the doctors don't need to be swapping them up very much. They need to be kind of letting you know, hey, this is something you need to deal with for a while. Once your body adjusts out, it'll probably get easier, and I'll assure you it probably will. So it is completely normal to have difficulties. Yes, it is tremendously completely normal that they might swap things up quite a bit, probably more than you want. But just be sure that maybe you ask them, why are we making these changes? Are we making these changes because of my blood work, my levels in my blood, or are we making these changes simply because I gave you some feedback that maybe I need to back off from just a little bit? Let things flow. Again, I guarantee you, I promise you, things will get better. But until then, please hang in there, keep on keeping on, and certainly stay stronger, my friend.